I'm Christina Fiore of MedPage Today, reporting from the American College of Allergy, Asthma, and Immunology meeting in Miami. Chronic daily use of nasal saline irrigation, typically delivered via a device called the Neti pot, may increase the risk of recurrent sinusitis. That's according to new research presented here by Dr. Talal Nasuli of the Watergate Allergy Center in Washington.
The conclusion of our study is long-term use, and I underline it, long-term use is not short-term use. Long-term use is saline. One should be very careful with that.
Nasuli investigated the association after several patients presented to his practice with recurrent sinusitis infection, reporting frequent use of nasal saline.
We observed them for 12 months without changing any of their treatment, and we noticed they were averaging about 8 sinus infections per year. Then when we discontinue the treatment and we observe them for about 12 months, they drop to 3 sinusitis per year in the nasal saline irrigation discontinuation phase when we discontinue. So this was a drop of 62% reduction in the number of infections once we discontinue this aggressive nasal wash. And we have a third group, a control group, that of 24 patients, and these patients were a control group. We continue to use the nasal saline, and they continue to experience sinus infection, about 6 sinusitis per year.
Constantly washing the nasal passages may remove protective mucus.
The explanation behind it is that if you look at the composition of nasal secretion, the nasal secretions are filled with immune elements. I call it the immune nasal blanket. And these immune elements contain lactoferrin, contain lysozyme, contain beta-lactotransferrin, and beta and alpha defensin. All of them collectively, they play a role of antibacterial, antiviral, antifungal activity. This has been shown.
Nasuli said physicians need to find out why patients use their neti pots in the first place.
What should be done? Patients often tell Dr. Nasuli, I'm doing it for a reason, because when I stop it, I get again the yellow-green mucus, I get infected. We have to find out why they are getting infected, what is the reason, and to treat it. And I had a patient that I saw not long time ago, and he was using it on a regular basis. We stopped it, we did a CT scan, we noticed that he had a low-grade sinus infection, chronic sinus disease, and we put him on appropriate antibiotic treatment for about 3 weeks, and then we stopped using everything, and the patient was doing fine.
Nasuli emphasized that short-term acute use of nasal saline irrigation should be fine. I'm Christina Fiore, MedPage Today.